So I think using AI is really powerful to help teach problem-solving skills to students and critical thinking skills. And I think that it can be seen as a threat where students aren't going to critically think as much because they're utilizing AI potentially for their answers to questions or on their assignments. But I think if we teach them again that important step of critically evaluating the AI output and synthesizing it to make it their own, that actually can help strengthen their problem-solving skills and critical thinking skills, which is one of the core skills that I want all of my students to have when they graduate or when they're done on rotation with me or finish a course that I'm teaching in, because that's something that irregardless of their specialty or path in the pharmacy profession, that is going to be important for their career. So my name's Kaitlin Alexander. I'm a clinical associate professor with the UF College of Pharmacy and a clinical pharmacy specialist in the Trauma ICU at Shands. The fourth year of pharmacy school is all clinical experiential rotations. And so as part of my faculty appointment and my role in the Trauma ICU, I take fourth year pharmacy students for their advanced pharmacy practice experiences or experiential rotations. So this incorporation of AI is to that learning experience. As part of the rotation, we cover different topics within critical care pharmacy throughout the 6 weeks of the rotation block. And one of those topic discussions that I lead is on the pneumonia and teaching students about how to assess a patient with pneumonia and then make a plan for their pharmacotherapy. And then I lead an open-ended discussion with them to help answer questions and clarify kind of confusing points, but it also helps me assess their knowledge and understanding of the topic. What I've done with AI now is try to reimagine that topic discussion where instead the students are prompting AI with short cases, clinical cases for patients, and then evaluating the responses that they receive within their small groups. So I think like most others, I did not have a lot of background or experience with AI until probably last summer after ChatGPT was launched. We really started to see it infiltrate in a lot of different specialties, topics, areas, and just hear more about it. I started to talk with other colleagues that were just playing around with what ChatGPT was, what AI can do, which kind of stimulated my interest and really made me realize how important this time is, this era of the onset of AI, and that I really do think it's going to be impactful for multiple professions, for healthcare in general, and kind of change that healthcare field and field of pharmacy going forward. With that, I learned of the faculty learning community at UF through the Center of Teaching Excellence and wanted to learn more about how I could incorporate AI into my teaching and learning. And from there, my interest has just continued to grow. And that's really helped me develop ideas about how I can incorporate AI with my students, hopefully teaching them that information literacy so that they're prepared to enter a workforce and enter healthcare during the time of AI.